The inspiration for this book was a study that we conducted several years ago on the issue of post-traumatic stress disorder in parents of premature infants. We have a fairly robust consultation program to the neonatal intensive care unit at Stanford Children's Hospital. And we found in our study that we were able to help parents with a 6-session intervention based on principles of trauma-focused CT. Since then, we've expanded our work, and we now have a group therapy model of the same intervention. And we decided to try to create a book that would provide a model for people who wanted to set up a program of psychological consultation in their own NICUs. As a result, we now have a book that goes through all the various steps that are necessary for setting up a program that starts with screening for mental health issues in parents and goes through the different techniques that can be used to help parents, including both the individual and group psychotherapy. One particularly great feature of our book is that we were able to put our treatment manual onto a website that readers of the book have access to, so that they now can download a copy of the treatment manual and the various handouts to use in their work with parents. This book is really intended for anyone who consults to a NICU and is particularly interested in working on the issues that parents have. I think often this is a very neglected area. There's a lot of focus on the infants, but less so on the mental health of the parents. The book also concludes with a very nice chapter on the issue of the vulnerable child syndrome, which is a pattern of overprotective parenting that often comes up with parents of medically fragile infants. And in this chapter, we describe an intervention model that we're currently testing with our colleagues in Texas on how to improve this aspect of care for parents. Yeah, this book was really designed for anyone who does mental health consultation to the neonatal intensive care unit in a pediatric hospital. This would include psychologists, psychiatrists, social workers who work with these parents, but also nurse practitioners, developmental and behavioral pediatricians, and neonatologists. A lot of the work is mental health focused, but there are some great chapters on psychological issues in general that would be of value to non-mental health practitioners.